Afternoon, I'm Michelle. After over 2 years of living with COVID-19, we are learning to adapt to a world with this disease. However, in the first 2 years of the pandemic, nearly 15 million more people died globally than would have been expected during normal times. In December 2020, the FDA gave emergency use authorization to COVID-19 vaccine, and the scientist Kathleen Carrico has played a big part of the success of it. In the following 9 minutes, I would like to talk about Kathleen Carrico's RNA gene medical treatments for disease and RNA therapy research, the roles she took as the CEO of RNARX and as Senior Vice President at BioNTech. And the most important part, the technology for COVID-19 vaccines. So that we can get to know more about the big difference Kathleen Carrico had made to the world. Kathleen Carrico was born in Hungary. She excelled in science during her primary education. After earning her PhD at the University of Czech, Carrico continued her research in Hungary, but she left Hungary for the United States with her family after the lab lost its funding. Carrico is Hungarian-American biochemist who specialized in RNA-mediated mechanisms. Moving on, let's look at the next slide. Using the timeline, we can organize a few main points easily as the slide shows. And now I'm going to explain each crucial scientific contribution that Kathleen Carrico had done from 1985 to 2020. Between 1985 and 1988, while serving as postdoctoral fellow at Temple University, Carrico participated in a clinical trial in which patients with AIDS, hematologic disease, and chronic fatigue syndrome were treated with double-stranded RNA. Although the antiviral effects of interferon were well documented at the time, this was considered groundbreaking research, as the molecular mechanism of interferon induction by double-stranded RNA was not known. In 1990, Carrico was hired by the University of Pennsylvania as an adjunct professor and worked with cardiologist Ilya Banathan on messenger RNA. Carrico submitted her first grant application, in which she proposed to establish mRNA-based gene therapy. Ever since, mRNA-based therapy has been her primary research interest. She was on track to become full professor, but grant rejection led to her being demoted by the university. In 2006, Carrico and her partner, Professor Weissman, founded a company, RNARX, to develop mRNA drugs. And they also received patents for the use of several modified nucleosides to reduce the antiviral immune response to mRNA. In 2019, she took a role as vice president at BioNTech and subsequently became a senior vice president. Having discussed the previous points, now I would like to direct your attention to the most important scientific contribution Carrico did: the hard work and technology for COVID-19 vaccines. With the COVID-19 pandemic requiring vaccine development on an unprecedented scale, mRNA vaccines approaches held a clear advantage over the more traditional but time-consuming method of using a dead form of the virus to create an immune response. Carrico has been at the helm of BioNTech's COVID-19 vaccine development since the work and research of Carrico was a foundation for BioNTech and Moderna to create therapeutic mRNAs that do not induce an immune response. In 2020, Carico and Weissman's technology was used within vaccines for COVID-19 that were produced by Pfizer, BioNTech, and Moderna. Furthermore, the adaptability of mRNA has opened a new field of therapy, not just for vaccines, but also for medicines in areas ranging from cancer to stroke and cystic fibrosis. Kathleen Carico also gained lots of recognition from well-known experts and entrepreneurs, such as biologist Richard Dawkins and co-founder of company Moderna Derek Rossi. They both praised Carico for her hard work and contribution. In the previous slides, I have discussed a few scientific contributions that Kathleen Carico made, and this has brought us to my conclusion. Not only did Kathleen Carico's achievement on mRNA therapy and technology makes a difference to the world, her true passion for science and the dedication to her work was what I genuinely admire for. This is why Kathleen Carico deserves to be one of the most influential people of 2021. This is my presentation. Thank you.
Okay. Right, so thank you very much. I think so, Michelle. In fact, I think you still have maybe 1 or 2 minutes. So, would you also like to elaborate on the mRNA technology she develops? Would you like to explain how this can maybe help us to fight against COVID-19?
She and Professor Weissman's research on mRNA therapy to COVID-19 vaccines is about the antiviral immune response. mRNA therapy in the past cannot overcome. And so the technology she and Weissman work on give to the their patents give to the company like BioNTech for them to further to make the vaccine furthermore. Yes.
I see. So you mean that they agree that the other pharmaceutical companies can use their patented technology to develop vaccines?
Yes, the BioNTech Pfizer company buy their patents.
Okay. So you mean Pfizer actually paid for their patent? So that's why they can maybe produce the vaccines against COVID-19 much faster than before.
Yes.
I see. Okay. Thank you. Very good. All right. So now I think we can maybe invite a few questions and comments. Again, feel free to speak.
I would like to ask you a question.
Yes, please. Yes.
I think she will be very famous because of the COVID-19 outbreak. But do you think that she is? If you were Carico, do you think that you are very lucky because of the COVID-19 outbreak, or you would rather to continue to do research in the laboratory, but you cannot be so famous at present now. But there are many people will not be affected by the epidemic, and many families will now suffer very seriously from this outbreak. So will you choose to be very famous because of the COVID-19, or you would like to think that there is no outbreak of COVID-19, but you will be not famous at present?
I have searched on the website the same article and the same question of the article of the same question, and she once said in the interview that she hopes there's no COVID-19. Although she become famous of COVID-19, but she hoped that there is no COVID-19 so that everyone will not suffer from this pandemic and die from it. And she said that because she has been primarily just make research on mRNA therapy, so she thinks that her passion and love for mRNA therapy will not stop although she's not famous. Thank you.
Yeah, thank you, Andrea. I think it's a really thought-provoking question. Yeah, I think sometimes we would say one man's loss can be another man's gain. Yeah, maybe that's the case for Dr. Catalina here. Okay, very good. So another question or comment? Okay, maybe I can also ask a question. I think I'm really curious about this mRNA technology. So I mean, besides helping companies to develop vaccines faster, so is there any other application of this technology? I mean, can we use that in medical treatment?
Yes. Carico has used the mRNA therapy with AIDS and chronic fatigue syndrome and like some other like cancer and stroke. So the mRNA therapy is gaining more and more use.
I see. So it seems that in the near future, like what you said, maybe she's going to win the Nobel Prize. Okay, good. Yeah, thank you. And so do you have any other questions or comments? Again, to speak, you just need to turn the mic.
I want to ask.
Yes.
You have said that the mRNA vaccine have the advantage that it may not induce the immune response. But do you know that the vaccine do have other shortcomings?
Yes, but I think every treatment for like vaccine will have different kind of bad react for different people. Like everybody have different body conditions or the disease or allergic will happen. So despite the mRNA vaccines will not have immune response in the research and lab, but I think everyone may encounter different allergic. Yes.
Yeah, I believe it's a rather difficult question to answer. Yeah, but I think Michelle gave us a convincing answer here. Good. I'm sorry. I just want to confirm. So who's the one who asked the question? Can I have your name?
Oh, me. Anne.
Oh, Anne. Oh, sorry. Yeah, I didn't see the blue ring. Okay, good. Thank you. Yeah, I think it's a good question. Okay, so if there are no further questions, let's give Michelle a big hand. So thank you very much for the presentation. All right, so very good. So now we're going to move on to our next